not just to save lives. We're fighting misinformation, and both cost Black lives. So I want to introduce my panelists today. Um, our first panelist is District 6 State Senator Erica Geis, Michigan's own, Dr. Anila Ricks Cord, of Pontiac City Councilman Kermit Williams, Dr. Kenesha J. Evans, Dr. Janelle Lee Allen, and policy analyst Patrick Grayson. Say hi, everybody.
No.
Okay. So I'm going to tell y'all, jump in when y'all can get in. This is a conversation. We're going to talk. We're going to keep it on that level so that your cousin that doesn't know anything y'all are unsure about, that he gets it. So we want to make sure it's going to be on that level. So anyone can jump in. I want you to know, what work are you doing with the vaccine? What's your background? And why do you think African Americans are hesitant to take the COVID-19 vaccine? Go ahead, jump in, anyone.
I'll start off. Again, I'm Kenesha Evans. I work currently in the city of Detroit, infection control. So I am every day coming across the numbers of surveillance in terms of our infections, not only COVID, but bacterial infections as well. To answer your question, when we look at the numbers of just in the city of Detroit, as well as Wayne County, we are currently in the top 10 in terms of the number of COVID deaths. Like, forget your case, we're talking about just deaths. We're in the top 10. We have come down because of, I can commend our governor in terms of the things that she's done in terms of her mandates for us. We've gone from being number 8 to now we're number 9, but we're still a part of the top 10. Currently, we're still over 3,900 deaths in terms of Wayne County. I'm not talking about Oakland County. I'm not talking about Macomb. I'm talking about Wayne County. And then when we look at the number of people that have been vaccinated, when we compare two counties, and I know that there are a lot of variables that go into that, and this is a part of what I do in terms of infection control and epidemiology, looking at how, if you look at the outskirt counties like Oakland County, there are over 159,000 individuals that have gotten the vaccine, whereas Wayne County, only 49,000 have been vaccinated. That is a big difference when you compare the number of deaths. I am not even going to talk about the number of cases. We all are aware we're unfortunately at a point where I think we are kind of numb to the numbers, but it speaks volumes when you say we're in the top 10 of deaths and we only have 49,000 people vaccinated. I think that, yes, there is a level of mistrust in the healthcare system, particularly for our community. We don't even have to go as far as the most popular being the Tuskegee Airmen. We can just look at some of the things that have happened right here in the city of Detroit in terms of things that have done in the 1960s, dating back to 1930s, in terms of how African Americans have been utilized for clinical progression. So yes, there is this mistrust, but we're not in that setting right now. We're in a setting where we are dying, and we're dying much more higher than our counterparts.
Yeah, just to piggyback off of that, essentially when we talk about, we're here in Michigan for sure, and I am as well as with Dr. Evans. But when we talk about African American deaths, there is APM Research Lab that is one of the trusted sources for basically the color of coronavirus. And even in December, we were over 50,000 African Americans that have gone and been lost to COVID. And we're not just talking about older folks, but we also are talking about a very key number of Black males in their 30s and in their 40s. And of course, as well as Black women. So we are talking about Black children who have been orphaned by COVID-19, who are now maybe with grandma or granddad, who are no longer. And for those people who have lost maybe just one parent, we are talking about the economic impact of a 2-family house now becoming a 1-income house, and understanding how does that play out. And also, of course, with not just economics, but we are talking about the impact personally for job loss, for the mental health impact of COVID. So even those who are living are now dealing with the fallout of COVID-19. And even as Dr. Evans had mentioned, when we're talking about the importance of vaccination, we're talking about that because the more and the quicker all of us can get vaccinated, the quicker we can stop some of these variants that are happening and who we may not have the power. Our vaccines currently work on the 2 vaccines that we do have, particularly Pfizer has been studied, and the UK variant does work on that variant. But again, viruses mutate. That is exactly what they do. They are designed to do so. So the more hosts that we have that have no a way to fight against it, such as not having a vaccine, the more variants that we are going to see. And we really have to get the word out to spread and to vaccinate. This is what we do when we have a virus.
I agree.
If I can piggyback on that too, the Senator Erica Geis, talking about those variants, just this morning, I think it was, it was announced that there were 17 cases that we knew of this morning, and I haven't seen this afternoon's data, of the B117, which is the UK variant. 4 of them are here in Wayne County, 13 are in Washtenaw County, but that's still, these things don't just stop at the border and then not go anywhere, right? We are driving places because those of us who still have to physically go into work are going to work or going to school. And that's even more reason to make sure that folks are getting vaccinated. But we also need to make sure that in terms of distribution, that we are, those of us down here in Wayne County, we are the most populous county in the state of Michigan. So we also need to make sure that we're getting that volume to match the population that needs to get that vaccine, especially when we have the highest percentage of Black people in the state. We were one of the hardest hit communities. So we need to make sure that we are mitigating all of that, all of those risks as being among the most vulnerable by making sure that folks are getting vaccinated when we have the vaccine in our health departments. I think Dr. Rick Cord was also about to say something.
Senator Geis, you hit it. So I was going to talk about you mentioned the variants. And so the concern with the variants is, as Dr. Janelle mentioned a hot minute ago, viruses are no different than us. We have genetic variability as people, so that if the plague comes through, all your children are not clones of one another and they survive. That's what this virus is doing. Oh, you got slick. You decided you wanted to make a vaccine. Well, let me change myself up a tiny, tiny bit in order to make it so it's harder for your immune system to recognize me so that I can wreak havoc for 1 to 2 weeks inside you before you realize I'm there. The trick is, the more people you have vaccinated in a timely enough fashion, these variants, they're just making it so that they are easier to transmit. That's all they're doing. Like, oh, okay, you peeped my game over here. So if I turn my hat and turn it sideways, you still recognize that I'm still the same virus. So vaccination is crucial. It's absolutely crucial. People keep talking about this whole herd immunity thing. The only way we're even going to get even remotely close to that is that we have at least 70% of the population vaccinated. It's everything.
I want to jump in for a second. First, thank Lakeisha and Michigan County for allowing me to be here, because this conversation is too important. It needs to happen in every state, in every country. My background is in applied physics, and my firm works in data analysis, organizing, and social physics. We've done a lot of work in terms of talking with people and gathering data. And I'm taking a different stance on this from the actual immunology aspect. We're talking about messaging, talking to people, talking to I'm be colloquial, talking with folk that look like us. And we have a certain communication style, certain communication method. As they alluded to earlier, it doesn't stop at the border. It doesn't stop at Alabama state line. It doesn't stop at the Michigan state line. So we have to have these conversations with everybody. It's not a Black disease. It's not a white disease. It's not any of that. It is a disease. It's a virus. It is impacting everyone. But before we get to that, we have to figure out why people aren't taking it. Not only within the African American communities or community in color. Let me just generalize it there. We tell stories. We relate information through stories. A lot of these surveys, over 1,000 people participated in one survey that we did for a legislator in Alabama, and people want information. They're not saying they're not necessarily not going to take it, but I'm from Alabama. I live in Huntsville. Tuskegee was not that long. It's still on people's mind. Family members are still alive. Still remember that. That's going to hinder people from taking it. Every out of 1,000 people, we had six comments and questions about when will it be available? What are the variations of it? What are the different types of vaccination? Is it going to hurt? And just flipping the angle to the side, we have to figure out a way to these questions and tell stories genuinely, deliberately, honestly. But because sometimes the messenger and the message, sometimes they have to be similar. We've got to work on working with powers that have this outreach money, that have this messaging money to make include people like they're on this call to tell these messages to be able to comfort the people, because again, they're all the high tech terminology out that we want to, unless people understand it and they accept it coming from the messenger. Now I'm gonna flip up again. From our survey, 70% of the people said that an influencer, as we know them, would not impact their decision to take a vaccine. So there's so many variables and so many factors in terms of how do we convince people and have these conversations, these essential heartfelt conversations, people across the board. To me, one of the main questions that we deal with before we can tell someone go take the vaccine.
Just to answer your question in a more, I think when you get down to the brass tacks of it all, we're dying. We are dying, and we're dying much more than our counterparts. We already have a lot of underlying conditions that put us at risk for any infection, let alone something like COVID. And COVID is killing us. We are dying. The African American community is dying from a disease at a much faster rate than our peers. And whenever someone is like, well, I don't know, we're dying is my number one statement before answering any questions about what it looks like, how is it going to affect me. It is amazing how the patients that I've seen at the beginning of the pandemic don't even have the option to have the discussion of whether or not to have a vaccine. Wow. Because we were in a place where we were seeing something that was unheard of. So they don't even have the option to listen into a conversation like this. And that at the end of the day, that's the most important thing. It's like you want to learn about whether or not you have pain in your arm, whether or not you have 2 or 3 days of fatigue and a headache. People in December of 2019, they didn't have that choice. People in January of 2020, they had no idea what that would look like. But this is where we are now. And that's what needs to be understood. If you don't want me to talk about immunity, you don't want me to talk about mRNA, you don't want me to talk about what's in there because you don't understand what I'm talking about. Bro, we're dying.
That may need to be the message, Dr. Evans.
Yep. Kermit, I got a question for you. How are folks? Hey, Kermit. Kermit is the president of the Pontiac City Council. And I'm going to be biased, a friend of mine. All right, Kermit, you're on the ground. What are you hearing from people, and why are they hesitant to take the vaccine? Or, what are you hearing from folks before I assume anything?
Well, we're in 2 separate spaces. So we've got people who remember Tuskegee, who remember what happened with reproductive health for Black women and where gynecology actually came from. And we have people that don't trust medical professionals. It's good to see all these chocolate people on here today that are doctors and everything else, but that's not what it looks like when I go across the street to my hospital. And so we've got that history that we're dealing with. We've got people in 2 categories. There's some people that right now will rush to have the vaccine that are senior citizens and the civil rights movement, and they're ready, right? They say, if I can do this to live, because I lost 75 of my friends over this last period. They know it's real. But then we got people that are having house parties at the same time, not wearing masks. So you're talking about stepping to a vaccine when I can't even get you to put a piece of paper over your face. And those are the real conversations that we need to have. You're talking about we dying. They saying it's not us. Grandma died, but guess what? It could have been anything. It could have been old age. And then we have news stories like Hank Aaron took the vaccine, and 2 days later, he passes away. And we got to deal with that. That's real life. I mean, regardless of what the cause is, we have to be upfront with that. And I think what elected officials and other people have not been doing is being realistic about the plight of African Americans and people of color with healthcare in general. You can't really trust a doctor to start off with, so why trust a vaccine? Had somebody bring up the point to me, said, well, you know, Kermit, when they come to Pontiac, they're not going to be giving us the Pfizer vaccine. They'll be giving us the knockoff and saying it's what it is, instead of giving us the real thing because it's the history. And so those are the kind of questions and myths and other things that we got to unpack, because these are histories of doing that. We need to see some steps in the right direction with COVID aid. And so if you look at the disproportion of the businesses there, people are not thinking about a vaccine. We're not even at the point with a flu vaccine right now. And how long has that been around? It's been around. And so even with me, you know, I was hesitant to be on this panel because my question is, okay, I'm going to wait about 6 months before I take the vaccine. Let me see what side effects come out. Let me see what really happens, because I don't want it to be one of those lawyer commercials talking about, let me, if you took the COVID vaccine in December of 2021, you need to have a lawsuit. But that's real life in our communities. The question is, what are the steps? And what are the risks? A lot of people still don't believe that COVID is real. We started off with the 5G, whatever it was, and people stuck with that conspiracy and never dealt with the issue. I've had close loved ones to me pass away, and we're dealing with it every day. But there's a group of people who, just because it's been going on for a year now, people have blocked it out altogether. And so they're living their life like it's pre-COVID. And we have to talk to those people first, because those are the people that are affecting Big Mama, who are affecting Auntie, because they're coming in that space, but they've been at a nightclub the week before. And so to talk about the governor's point, she's doing a great job, but then you let people go back to school. February 1st, you said the economy is messing up, so we're starting over. We can't keep sending these mixed signals. Either it's a deadly virus that we're going to deal with, or we're not. It's safe to go to the grocery store. It's safe to go back to work out, but we want you to take this vaccine because you're in line to die. And so I'm going to be quiet right there. But I just wanted to make sure that we are realistic, especially when we're having a conversation with our people, that we're in two totally different places. Some people are living their life like this vaccine, this pandemic is over, and other people are fighting for their life every day. And we got to get the message to both people, especially in the African-American community, to make a difference.
If I can add to what Kermit just said too, also from the elected official sphere, is that there are people too who want the vaccine because they think that that means like, oh, I don't have to do any more of these COVID protocols. And we know that that's just not a fact. So you have, and who think that this is just going to be the miracle thing that makes everything go back to normal. And back to normal is way down the road, especially when you have folks who still, as Kermit said, don't believe that the virus is real and the virus is still impacting us, and who are frustrated. We're all frustrated with having to wear a mask every time you go out in public, and or if you're around loved ones who are health compromised. Like, you know, my mom is health compromised. Even when we're in the car together, I am masked up. Yesterday, I took her to an appointment, and when she came out, I had some phone calls I had to do, so I had the mask off then. And I realized I've got to put my mask on. And she said, "Well, I have mine on." I'm like, "No, we both need to have our masks on, because then that's, if you know, I work in a place where people do not take the virus seriously. So, you know, if I had it and didn't know it, I don't need to infect her." So we're still battling all of those pieces of this equation, which are the folks who still don't believe it, and then the folks who get that first dose and think everything's fine. And until yes, 70% of us have received it, both doses, it's going to be a long time before things are back to normal. So we still have to remember to keep taking all of these protocols, all of our personal safety measures, our situational awareness, all of that at the front of our minds.
I just want to piggyback on that. So, you know, the idea of having two factions, especially in 2020, is definitely very clear in so many different ways, right? And from politics to health, and all of it boils down to us needing to have a very common and agreed upon truth, right? And I think that there's a common saying that I grew up with. People believe people believe to be true what they see every day, right? So the only way that I can impact folks who don't necessarily believe the facts that have been, publicized, or, the fact that we've got, news talking about, over 400,000 people have died. For those folks, it's about touching them every single day. It's about touching them through things like this. And it's also about touching them through our own personal interactions. It is each one teach one. Because the bottom line is, I can't, some things you just can't move. It doesn't matter what you say. Sometimes it really is about showing people and allowing them to feel who you are and what you believe in the way that you carry on. And then, so that's that one point about getting people to believe. Sometimes that's a whole nother animal, but at the same token, we all have a responsibility to it. And then there's part two. So President Williams, you mentioned you want to wait 6 months. I have heard that so many times. My own mom, she's like, I think I'm gonna wait 3 to 5 months. Particularly, this was before Pfizer had even gotten its emergency use authorization. So here's what I say to that. I said, Mom, I understand. Let me do all the research for you, and then I'm going to come back to you and let you know. Fully, I understand. And that also speaks to Representative Grayson, how, you have folks who are just saying, hey, look, I just need more information. And I think that's extremely wise, right? We all need to make sure we know what we're getting into, right? So here are some numbers for you guys. One, unlike a lot of other new medications, this is not the same. We are in a pandemic. So typically when a new medication comes to market, there may only be a couple thousand people who have had that medication. And I'm talking about from phase 1, 2, and 3. And so that's completely different. In Pfizer altogether, there was 18,000 people. And in particular, 3,000 African-Americans, a little over 3,000 African-Americans. And Moderna's vaccine cohort, particularly for phase 3, there was 30,000 people, because it was 15,000 in each arm. So we are talking about over 25,000 people have received both of these both of these vaccines. In addition to that, at this point, with all of the healthcare providers and all the people in Group 1A, we are talking about over 11 million people who have had this vaccine. So I do want you to have some reassurance that you would not be the first one, and that there's a lot of data behind it that are watching for, and they're not called side effects, guys, just so that we know, when we understand, when we have a sore arm, that is an intended reaction. It is actually just a response to your body's expected and anticipated response to receiving a vaccine. Or any, kind of deposit in the muscles. I also want people to understand that, there's a local site reaction, and then there are systemic reactions. And again, these are anticipated post-vaccine reactions. Fevers, a little bit of muscle aches, chills. I had my first dose, and for the most part, I had Pfizer, just so you guys know. For the most part, I just had a sore arm for maybe a day or two. And then maybe a little slight soreness, a couple of days after that. But on the second one, I did experience the, kind of fevers, the myalgias, and things to that nature. Some people might say, well, why do I want to take something that will give me those kind of reactions? Here's the answer: because COVID can give me death. And I refuse to allow this virus to take me out, or any of my family members, or anybody who I can come in contact with. That this is one way that we are armed to the teeth. Certainly, we still need to wear our mask. We still need to watch our distance from people we do not know, or who we don't know if they're symptomatic or asymptomatic carriers. And we also need to continue to wash our hands, because we have those steps we know work. And we've known that they work since biblical times. Okay, when people had there were lepers, those people got quarantined so that they would not cost the lives of everybody else, right? So I think I've gone on enough, but either way, just know that we all have a responsibility, and there is a worse outcome, and that is COVID, the unpredictability and the high mortality of it, particularly in people who look like us. And that's the reason why the vaccine is important.
I would just add to one of my own, I'm sorry.
Okay.
Yes.
I was going to say, if you can wash your chicken, that's what we do. You can wash your hands too. Okay. I wanted to circle back 1 second. We talked about Tuskegee. Can someone explain why this is different from Tuskegee so we can dispel that myth? Because we're about busting myths right now. So could you explain, anyone, why this is different from Tuskegee, and how this is intended to save their lives, not destroy their lives? So go ahead.
So Tuskegee was a period of time where we had a treatment, penicillin, to treat people that had syphilis. But for a group of African Americans, unfortunately, instead of giving them the treatment, the physicians, the scientists said, let's see how bad syphilis looks. So let's not treat them. Let's just watch and see how bad syphilis looks. And the beauty of the fact that there are a lot of novels that are out here that kind of really goes into depths about not just the Tuskegee Airmen, but Henrietta Lacks, like he was mentioning about a lot of the things that we know about OBGYN, the father of OBGYN, did a lot of his testing on his slaves. So when you hear those stories, yes, they are embedded. The best part about Tuskegee is that a journalist got hold of what was going on, and that was the platform that put it out there. That now, not only that story, but also Henrietta Lacks, you have these committees, you have a lot of regulations in terms of your studies that are out there. You have what's called an IRB that establishes if you want to be a part of a study, you have to be as transparent as your study is. You have to let the patient know. There's a lot of autonomy. So those stories exist, and they're there basically based on the settings like this. There was a media platform that gave that unfortunate time frame a face. And so here we're here, and we're talking about COVID, which is a pandemic. And I think the theme of it is mortality. We are dying. That's the theme behind why we are here and why we're so motivated to talk about it. I always go back to my experience as the beginning of this pandemic. Unfortunately, yes, there are two columns in terms of people that are ready and willing to go get the vaccine. And you have the column of people that are like, oh, I haven't seen it. I don't know what it is. But it's not until you hear stories of physicians, of nurses, of any essential worker that have been near a patient that is literally fighting for their life, spending March till June working in the ICU, having to call way too many families to tell them that it's time, and your family had just walked in and was just feeling a little short of breath. That's real. That is real. You're having this discussion about it ain't touch me. That time frame to even consider it touching anyone in my family has been scary. So for us to sit here and discuss whether or not to get vaccinated, I'm choking up just thinking about the fact that we are at a point where we can be vaccinated. I got the Pfizer vaccine. I hadn't had any experience. I was sick at one time, not during my vaccination period, but prior to it. And it scared me because I'm around patients, and to be around my family and to even think that I could give it to them, those are real things. So it's time out for the discussion of whether or not we should be vaccinated. It's time out for all the just the uncertainty of everything. We're here to explain. We've worked all day. We want to come on here to really educate, to help you understand the gaps. I have no problems telling you what it looks like, why we produced it so fast, the fact that we actually had this going on, Mars and the Mediterranean Eastern syndrome that was during 2013 and SARS when it was first out. I'm mixing up the date. I want to say 2007. Though at those times, there was just periods of time. SARS and MARS never hit our platform, but what we understood about those two illnesses gave us the backbone of the mRNA that we're studying now. So we're talking about 7, 10, 11 years ago that the thought of an mRNA vaccine could even be thought of. So to say that, oh my gosh, it's too rapid. Oh my, how did we come up with it so fast? You have the money behind it. You have the population for sure. We're in a pandemic. That means it's everywhere. It's not just hitting one region, it's everywhere. So you have enough patients to study to get to this place where we have the most efficacious and safety as of right now, 90% efficacious in comparison to, yes, influenza, where it's only 67% effective, but it's still effective. People aren't dying by the droves from influenza, no, but it's still an effective vaccine. It has kept us from being in an area of 1920 when the influenza virus was first hit, and it was a pandemic like this. We don't even know what that is. Polio. What is polio? None of us have an idea of what it would be to have polio in our system. Why? Because we eradicated it with a vaccine.
So we're having this discussion, but when we look at some of the data, I'm looking at a survey right now that we did. 93% of the people said that they're concerned about COVID, that they never have contracted COVID, but only 3% of the people said that they plan on taking the vaccine. So the numbers are there. We got to figure out a way to tell the story and to make this story engaging. Now, I agree with everybody on here who said dying is the message, because that really does resonate with people. But we have to figure out a way to make this message more engaging. I don't know how much further you can do that without saying you're dying. To me, that's a pretty strong message. But we have to tell this message to people that are on this video stream, that are cousins, that are friends, that are doing other things, that are carrying on regular life. I don't know how they could do that during the pandemic, but we've got to figure out a way to convey this message and to make it strong, deliberate, and passionate, so that everyone understands that it's real if they don't know it by now.
I say we take it to the pulpits, but we
got amen, sister.
You're virtual now, so nothing's going to stop us. We're getting a whole bunch of questions, and I'm going to kind of mush them together in one. Some of y'all already have taken the vaccine. Let's talk about y'all side effects, so we can knock that out the park. Somebody said, one of y'all mentioned that y'all had a little bit, but could y'all go into detail about the side effects for those who have taken the vaccine? It's apparent y'all not growing 3 arms or 5 legs or anything like that. So
did not a zombie. I promise you, I am here. I'm still here.
I ran 7 miles yesterday and 10 the day before. Okay, I can breathe well. I am a runner. I plan to do a 30-miler at the end of in August. So, but when you are trying to understand, the word isn't side effects. The word is, does my body mount a response to say, hey, there is something foreign here and I'm responding to it. The expected response that we are saying is that you were injected in your arm and your body said, hey, what's that? Let me mount a response. What does our body do to mount a response? We have a bunch of cells that come out and cause us, our body is actually causing the fluid, the redness, and that pain sensation that you get right here in your arm. That is an expected response. That is not an adverse response, which is what people are looking for. This idea that you're going to grow a leg or an arm. No, that's not an adverse response. Also, when we're saying that we're getting the vaccine, we're getting, like, if you think of it like a balloon and you had spikes all around the balloon, we're getting the spikes of the balloon. We're not getting the body of the balloon. We're not getting what's inside the balloon. We're getting the spikes. And because we're getting the spikes of the balloon, our body is still seeing this as something that is foreign. And sometimes for us, when we see something that's foreign, technically it's throughout our entire body. So that's where you get the idea that you feel tired, you feel a little fatigued, you may have a headache. These are our expected responses. Now that is different than someone that has anaphylactic reaction. Anaphylactic reaction is when you, for the sake of the extreme of it, is when your airways are clogged, we got to intubate you, you have rashes, your skin is coming completely off. That is the extreme of an adverse reaction. So there is, my body is responding to the fact that I got something foreign, an adverse reaction. So these are my expected results that I am anticipating. I may or may not get it because Dr. Evans didn't have none of them. She had arm pain and it went away. That's all Dr. Evans had. She didn't have a headache. She didn't have no fatigue. And when I say that, I'm talking about me. She didn't have any of those things. And I am now at a point where we would say I am what's called I have developed immunity because I am now 14 days post my last second dose injection. And that is completely different than when we're saying adverse reactions.
And then
go ahead, Janelle.
So I was just going to piggyback. So let's talk about what does it mean to have immunity? I think I saw a comment that, was asking, well, why do we still have to wear a mask even after receiving the vaccine? So here's what a vaccine does. It essentially teaches your body what to look for. It doesn't mean that you will not come into contact with the coronavirus, okay? It doesn't mean that it's almost also a good analogy. One of our other physician group members likes to say it's like a seatbelt. It's to say that, it will protect you from the worst outcome if you were to get the virus, if you were to come in contact with the virus. It is that safety net. What does that mean? What does it mean to be a safety net? So essentially, not just like a seatbelt, but also what we're doing is, as Dr. Evans says, you get the protein that exist on the coronavirus, which we have known about for many, many years, and which we have tried, have fought for many years. This is just a different strain of the coronavirus that is new. So with that being said, your body will then know how to respond. Your body will generate the little white fighter cells that it needs in order to attack the virus if you should come into contact with it. And for many of us, that will be many, because this is a pandemic, which means that it is ubiquitous. It is all over the place. You don't even know it. So with that being said, once you have been vaccinated, then you are able to have fighter cells that knows what to look for and knows what COVID-19 is, and they can begin to attack COVID-19 should it come into your body. And they can begin to attack it before it can wreak havoc in your system and cause severe symptoms, including, of course, death.
All right, we are getting flooded with questions in the question box and in the chat box. So I'm going to go and ask some questions, get some questions, give you some questions here. Someone wanted to know, what can you share about the Moderna boost for the new variant virus? I'm let y'all, I wish I spoke science. I wish I spoke medicine, but I guess they're talking about the new variant virus for the Moderna shot. So does it work? I'm going to simplify it. Would it work for the new strand of the virus?
The reality is that the COVID is probably going to be like flu. Again, we mentioned earlier that viruses change their variability in order to, or they change their genetics in order to be able to hide out so your immune system doesn't see it. The issue when someone, I think Dr. Evans referenced earlier, she referenced SARS and she referenced MERS. So the coronavirus we have now, it's the 7th version of the coronavirus. And the trick is between when SARS popped off in the very beginning in about 2002 till now, she learned how to become more transmissible. She was more fatal a hot minute ago, but now she's better at infecting you, your mama, your little cousin, your grandson, and his friend. And the issue is, I live in El Paso, I don't live in Michigan, and I'm delighted to be present. But when we talk about communities of color, what I've seen in this community is that people don't understand that you're not going to get COVID from some stranger. You're going to get it from somebody you're related to. I practice as an obstetrician gynecologist here in El Paso, and I will tell you the sad, sad things we've seen. When Dr. Evans was sharing her heart with you about the death that she's seen, I have seen COVID in and of itself, having probably had it in February and gotten my vaccine in December and in January, I would get it all over again. I had swelling up underneath my lymph nodes. It knocked me down for 5 days. I had fatigue, I had headache, I had chills. Don't care. We'll do it all over again, because what I had in February after a dental procedure, and I think the only thing that saved me was I got a dose of steroids in office and I got a steroid taper before we really knew. We were arguing with Spain about whether or not steroids made a difference with your response. And the steroids I think I got then made the difference. I had aches across every organ system. I have never had my butt hurt where your hips insert into the joint, your kneecaps hurt. Like I thought, oh Jesus, if this is arthritis, dear God, what happens when I actually turn the corner and I actually get it? Every joint that I had hurt and sang like nobody's business for probably about a good 3-day period. But the variants that you're seeing, the thought process is that at some point in time, perhaps a vaccine that we have will be less efficacious and it'll be as effective as like the flu vaccine is in and of itself. The reality is, as someone mentioned, I think Senator Geis mentioned, or someone said something about getting back to normal. The reality is this is probably going to be our normal for a hot minute. Viruses change their surface proteins. They modulate who they are in order to be infective. That's their whole job. And so COVID is going to continue to switch the outfit that she wears in order to make it so you can't see who she is in order to be able to infect you, because that's what she's trying to do. So yes, we probably will get to the point where we need boosters, just like every year we get a flu shot. That's the reality. And when you talk about what's worse than the vaccine, COVID and dying, and even outside of that, the thought process is what doesn't kill you makes you stronger? Not necessarily. There's some people who contracted COVID and have what's called the long hauler syndrome, where they still got symptoms months afterwards where you can't breathe. And the reality is the reason I think I had COVID in February is because I had shortness of breath. I could not stand in the shower with a warm water coming in there for any length of time. And that was for a good 8 weeks. And I thought it was steroids. A medical professional, as seasoned as learned as I was thinking, oh God, why would anybody take steroids? This is horrible. No, the shortness of breath is probably because of the virus that I contracted when I went to the dentist and was there with my mouth open for 3 hours before we really knew what COVID was, how it was transmitted. So this is part of our new normal. I'm done. That was it. I just wanted to get that little bit out.
We can't hear you. We didn't hear anything.
I apologize. I'm sorry. I'm so used to just talking. All right. Someone asked in the chat if they've had bad reactions to vaccines when they were a kid, will they have a bad reaction now? Is that, can y'all answer that, or is that something they can talk to with their doctor?
So there are.
Go ahead.
Okay, so I was just going to say, so one thing about this vaccine is it's very interesting in that it's very simplified. Unlike the flu vaccine and a lot of other vaccines didn't need to use eggs and things to that nature. So it's not like a lot of the old vaccine science. So that's one good thing. The other good thing is that there are pretty much like 3 ingredients. It's the mRNA. There's also nanolipids, which is basically how it allows it to get into the body. And then there's also something called polyethylene glycol. This is something that we actually is pervasive for anybody who has had constipation, or if you had a colonoscopy. Kudos to the gastroenterology fellow. If you had your colonoscopy, that makes me happy. But just back to what are the ingredients of it? Polyethylene glycol is the same type of ingredient found in Miralax, as well as found in Go Lightly if you've had your colonoscopy. So one thing that they have said is if you have ever had any anaphylactic, meaning like you couldn't breathe anymore, you had to be intubated, or you had to receive an epi shot in order for your life to be saved. If you ever had that kind of reaction to things like Miralax or to things like Go Lightly, that's a contraindication for you to receive the virus. If you have not had that kind of reaction, or if you've had, then you don't have a contraindication. You can receive the vaccine with a couple of caveats. So that means that there are some precautions. If you are somebody who normally has an EpiPen, you need to bring your EpiPen always with you. However, people who have had infusion reactions, meaning that you've gotten medications that have had to go in through your IV, or you've had large medication deposits in the muscles, and if you've had any allergic type reactions, meaning like itching, meaning like some hives. Those are things that you will want to go to get your vaccination and let them know so that they can watch you. Instead of the standard 15 minutes after your vaccine, they're going to want to watch you for 30 minutes after your vaccine. In addition, please understand that everywhere you go to get your vaccine, there is epinephrine, meaning like medications that if you should have a reaction, maybe you just didn't know, maybe this is the first time, they are trained professionals. That is what we do. This is not new. It's not new to the COVID vaccine. This is something that anytime we're giving injections, we are ready and willing to, make sure that you are okay and make sure that we have medications. Even I've heard some people in the past, and I just saw a question pop up that said, well, what happens if someone had a reaction with Guillain-Barré? So one thing that the clinical trials did show is that all of these different type of reactions, whether it be Guillain-Barré, whether it be Bell's palsy, we've seen some of the social media posts, all of those things. These things happen in life. And what we found is that during the clinical trials, and even as millions of people are now vaccinating, what we have found is that the occurrences of these types of reactions are not happening more with this vaccine. That means even if you receive the placebo, you could have, in some respects, gotten the same types of reactions. So it's to understand that that is not a contraindication to getting the vaccine. And these are also conditions that are treatable and can be handled with medications and with care. Okay. So again, there aren't too many contraindications to the vaccine other than the one that I just cited, the polyethylene glycol.
Woo-wee, thank you. That was awesome.
Bell's palsy, you don't actually need medication for it. It's something that spontaneously resolves on its own, even if you got vaccinated or you got it from a virus in itself. So just FYI.
Yeah. Well, with Bell's palsy, sometimes people get steroids for it, like doctor. So those are the medications I mean, not necessarily epinephrine, I think is what Dr. Evans was getting that.
Okay, so I'm going to ask Kermit, I'm going to ask State Senator Erica Geist, and I'm going to ask Patrick. Okay, so y'all, we already know the facts. We're hearing the facts. How can we convince, you guys know people, how can we convince people? Who do we go to? How do we convince people that this is real, that they should, seek information about the vaccine and, hopefully make the right decision for themselves? I hope they get the vaccine. That's me personally, but I'm not supposed to. But how can we convince those folks that this will save their life, and not only their lives, but their friends and family too?
Okay, I gotta go because we got council meetings starting in 6 minutes, and I got a host, so I will be jumping off. But I thank the panel, thank Michigan United. This has been tremendous. I learned a lot. I feel better about taking the vaccine after hearing this discussion, so that's good. So I think I'm almost there. One more panel might get me over the edge before my 6-month deadline. But seriously, 2 things that we need to deal with, Senator Geist and some others, is dealing with the policy behind this.
Kermit, you went out. There you go. We can hear you now.
Okay, I had to shut some stuff. So can you hear me now? So I was saying with Senator Geist and others, we have to come up with a policy to reduce the stigma around corona in general. The first step is getting tested in our community. And because there's been no real information about pre-existing conditions or other things or how corona is going to be used against you, there's a portion of the population that even though they feel the symptoms will not get tested because they don't want that doctor's record that says that they had corona, because they don't know how it's going to affect them going forward because it's so new. And so in order to, I think, even make the vaccine more palatable, we need to have something that says that life insurance companies, health insurance companies cannot use this corona data against you. And so much like the census, the reason that our numbers are finally growing is because people realize that the government can't get them for 75 years. And maybe that's the same thing with this corona data. It's got to be something to safeguard and protect people, because people will suffer in silence versus not being able to get their life insurance or other things. And these are the kind of things that just regular people think about that will keep them from going. And it has nothing to do with the actual vaccine itself. It's just what happens when I get in that pot. And so if we can do that, I think it will be good. I know I'm jumping off, but if we can band together, I think as elected officials and others to kind of spread that word, that would help, because people don't necessarily always see the benefit of the vaccine other than them having life.
Thank you, Kermit, for joining us. Thank you so much. You were fantastic. Bye. All right. So go ahead, Senator Geis, you can go ahead.
Yeah, Kermit made some excellent points. And I think one thing we need to look at is the work that the Racial Disparities Task Force on Coronavirus, and I think I just said that inside out, but there is a task force that was convened at the state level that looked at the racial disparities around coronavirus, and including the vaccine. And so looking at what their recommendations are, looking at how we can make sure that we're disseminating, we're giving out accurate information in digestible blocks as well. So for all of us who are elected officials and who are also doing the community work of our social and our community organizations, making sure that we are getting folks that information. So for example, like testing for the coronavirus, everybody in our state can go to the michigan.gov/coronavirus website, and they're like right up front, like within like the first like quarter of the page, you can click find a test site near you, and you can plug in your zip code, select the mileage, because you might want to do one closer to where you work or go to school versus where you live, depending upon where you're at, so that you can get tested. And I will tell you, I have been tested 5 times, and thankfully it's been negative every time. But doing that is important. And the same with getting the vaccine, and our local health departments are putting out information around what phase we're in. And right now we're wrapping up phase 1A for the second dose, which folks like Dr. Evans described already has had both doses, and moving into phase 1B, which is the folks who are over 65, or 65 and over, I should say, and making sure that folks are paying attention to when they get those notifications from their healthcare provider, and so that they can get in line to get their vaccine, and that they keep those appointments. One of the stories we've been hearing is people who, I think in some other states were waiting in line in the hopes that there'd be extra. And part of why there was extra was because folks didn't keep that first appointment. So the other thing too that we need to be very mindful of is the equity issue around making sure that folks who can't get to the health department or to the various locations that they're distributing the vaccine by car themselves, making sure that folks who are on public transportation can get the vaccine, making sure that they are that the areas where you can get the vaccine are populated throughout all of our communities. So those are other issues as we're going down the pike and opening up more of the population that is able to get the vaccine, that we need to do in order to ensure that we hit that 70% at minimum population for getting the vaccine.
Thank you.
And conversations like this are so important.
Absolutely, absolutely. We even have some stuff where people are dropping some kind of myths in the chat box. So someone is making a point that only big people, or not big people, people with I can't pronounce it, people with illnesses weren't tested with the vaccine. People that have diabetes and things like that. Is that true? Is it not true? We want, like I said, we're here to debunk stuff. Do you know who the vaccine was tested on? What kind of conditions they had or anything like that? So go ahead and if y'all can explain that.
So Janelle had actually, excuse me, I apologize. Dr. Lee Allen had mentioned earlier in terms of the the population that was a part of both studies were representative of the general population across the span from African Americans to underlying heart disease to diabetic patients to morbid obesity to someone that's otherwise healthy and with no comorbid conditions at all. Both studies definitely represented the general population in terms of the numbers of participants.
I agree. And also the studies actually had pregnant women in them. They didn't enroll them. They had 36 that slipped on through and got pregnant after they got into the trial, but they had 36 pregnant women inside there. So from my standpoint, from an OBGYN standpoint, that's everything, particularly because when Mr. Williams was alluding to earlier, fear over the vaccine in our hospital setting, there were vaccines that became more readily available to people who were in theory lower on the tier because lots of nurses elected not to get it because they were afraid that it would compromise their fertility or actually cause them some issues with illness later on. And it's amazing. Knowledge is power and it's everything. It's an mRNA virus. It's degraded after it does what it's supposed to do. You know what's going to jack your baby and jack your fertility? COVID. Because even if it doesn't get you to ACE2, it's going to get you to CD147, which jacks the lining of your uterus. It jacks your ovaries and eject sperm quality. You know what else does badness? COVID, because COVID causes sperm to be defective for about 72 days. So yes, let's be real.
So Dr. Rick's court, I have to jump in at this point. I have to in and just make a few comments. All of these stories are so impactful. Everything that you've said, each one of these little boxes looking at has a story that resonates with one. And I think it may be a task to start collecting these, bring them into something that can be distributed to people. Because what Dr. Rick said, I had never thought about that. I had never thought about how that ended so many aspects. Dr. Lee Allen said what Dr. said. Guys, about the process. These simple things in terms of messaging that gives the community trust. I think that this panel that we're on, we have an obligation along with other people to figure out how we message a strong, genuine message to people to the questions, but at the same time convince them that you might not want to die from COVID. That's the one message that I'm messaging. I do social physics, do all the analysis, but with all the high terminology being put on this call, don't get COVID, don't die, is a message that has resonated with me that Dr. Evans was saying. So I'm just throwing something at you, Lakeisha. That could be a task that leads to this whole conversation, is collecting these stories, putting them together, reaching out to people that might not be on this call, and showing that the thing is real, and we need to have the conversation and get vaccinated.
We got another question in the chat, and I thought that was super important. Someone asked, should pregnant women get vaccinated?
Okay, so let me step outside the box and say first, before I say what it is, I'm going to say I am not your doctor. You need to talk to your doctor about whether or not that's a choice that you should make. But what I will tell you personally, what I have seen as a practicing OBGYN, so I've been out of residency for 15 years. I currently work as a 24-hour OB/ER doctor. And what I can tell you is in that fall, when you started to get upset, Dr. Evans, with your face, there was a time where you could hear in a 24-hour period, people dying left, right, and sideways in the unit where you knew they were going to go meet their maker. And it got to the point where when you heard the code being called over the system, you just got into a corner and started rocking because literally it gave you PTSD. But yes, ma'am, in the grand scheme of things, I'm beyond the age of having human beings. I'm 49 years old. Nary another person will come from my personal space. But if I was still in breeding mode, I would definitely still get the vaccine. The difference is, I attended a lecture not too long ago about lactation and COVID. And what they found is that mamas who got COVID who were breastfeeding, that there were antibodies that were in that milk that protected their child for upwards of at least a year in the grand scheme of things. And so when we look at what I think anecdotally has been happening in pregnant women secondary to COVID, testing is everything, and a lot of folks didn't get tested. We know that COVID causes, among other things, changes to blood vessels. We know that in ladies who have actually had COVID, you look at a placenta, you can actually see it's all jacked, it's all wrong. It's calcified, it doesn't work the way it's supposed to. And the placenta for a child is everything. If my placenta is jacked, then my flow to my human is jacked. So you think about the fact that viruses love rapidly dividing cells. What else is a little human being other than a bundle of rapidly dividing cells? And for people who are saying, oh my God, vaccines, they cause autism. Okay, sidebar, and I'm about to make a whole bunch of people angry, but the reality is you have a genetic predisposition for autism if that's what you got. The thought process is in utero, something happens, like say, I got pyelonephritis. I got an infection in my kidneys, and then I was pregnant and I heated up and got real, real hot. And my little human brain on the inside got too hot and it changed the way the brain actually was made. Form follows function. And so all of this is to say, would I risk being pregnant with a bundle of rapidly dividing cells that I expose to a virus, and they think that actually exposure earlier in the pregnancy does more badness than later. They think that there's less vertical transmission from mama to child in like that third trimester. And they actually think that there is vertical transmission, but they think it's less likely to occur when you're in your third trimester. But I have seen an increased frequency of miscarriages, an increased frequency of preterm labor and abruption, where the placenta kind of pulls off. And again, if the placenta is everything, if it's functioning like lung and like heart essentially for your child, or lung and kidney for your child, if that thing is no longer there, then there's no child that's there that's sustained and growing the way it's supposed to. I've seen an increased frequency in losses from 18 to like 22 weeks, that paraviable standpoint where technically viability is 24 weeks. You can survive outside of your mama, 50-50 chance at 24. Folks don't get to 24 weeks. In ones who've actually had COVID, if they had symptoms, the thing about COVID is in pregnancy is sneaky. When it shows up, it doesn't exactly look like, hey, I'm COVID. That's not what it looks like. It will make other complications of pregnancy are the forefront. I've seen people present like they had preeclampsia, and then when you do their labs, you're like, this don't make no sense. And it's because it's not, because it's COVID. And when you look at them, typically when people are sick, you can draw a CBC where you look to see what your white cells look like, what your red cells look like, which elevation is there in whites, who's doing what, is it virus, is it bacteria? COVID is like, click up, click up, click up. Your stuff looks absolutely normal when you come in to be assessed when you're sick. The only thing that's the sign is that you might have a fever out the wazoo, or that in some of these ladies who have had COVID that were pregnant, when they deliver, then they bleed like stink when it's all said and done. I'm talking massive hemorrhage. I have seen ladies in the ICU on a ventilator, pregnant, where the machine is breathing for them, or ones that their lung capacity got so bad, they got acute respiratory distress syndrome where they couldn't breathe. Lungs become, the issue with COVID is it actually makes a jelly-like substance inside your lungs, which is why your lungs don't work the way it's supposed to. You're not supposed to have jello inside your lungs. And so there have been ladies, there was one lady that I had the opportunity to care for that came in, that was 32 weeks pregnant, that deteriorated, had to have a C-section, and she stayed on a ventilator for 17 days. It's no joke. Pregnant ladies, in theory, are more, there's a thought process that, are we more vulnerable? Are we not more vulnerable, pregnant ladies? But the thought process is that if you get it, you're more likely to get sick as snot. So all of that is to say, yes, ma'am, you talk to your doctor about what's best for you. Just like Dr. Lee Allen said, if you got PEG allergies, don't do it. If you're allergic to anything inside the vaccine, don't do it. There's a suggestion that if you had the first dose and you had an anaphylactic response, you don't get the second dose. The choice ideally is yours to make. But if you think about affecting generations, and we know that flu contracted at a certain time in your pregnancy increases the likelihood of schizophrenia for your unborn child, man, I wouldn't trust it. I would not allow a virus to get access to my child to change form or function or even flow from the placenta into the human. So that's my 2 cents. Talk to your doctor about what works best for you. But if I were still having humans, I sure would get a vaccine. If I were pregnant, I sure would get a vaccine.
Ooh, she testified.
He said, but just check the website.
Snaps, 2 snaps for that.
Exactly. All right, there's a question that, I mean, this question reminds me of my people. They asked, is it best to go to a predominantly white area to get the vaccine? I don't trust on Black and Latino areas because, they're afraid they're going to give us something else other than the actual vaccine. So, what do y'all have anything to say? But I swear to you, I've heard things like that before. We are here. Our people say, I'm not going to the hospital in my neighborhood. I'm going to go into that neighborhood because they treat people better over there. So
I live in El Paso, and everybody is Latino here, and the Latino gave me both of my shots. So yeah, you do what works for you, but I didn't drive. Actually, if I had to drive a place to find a Black person to give me the vaccine, I might be in Dallas or Houston, and that's like an 8-hour trip. Like, yeah, no.
Mhm.
The reality is, as precious as this thing is, if you have an opportunity to get it wherever you can get it.
And just know that this vaccine is one of the most transparent processes as possible. The whole world is looking at these vaccines. And there are so many different guards when it comes time to serial numbers, making sure it's cold enough. There is so much that is going on behind the scenes with this vaccine. So, go to a source that is a hospital that has people who are badged and have degrees and who are for sure letting you know that they are licensed professionals. And that is where you want to go as soon as it's available. And also, I'm going to have to apologize, guys, because today is my beautiful baby girl's birthday, and I have to get back to birthday dinner. But it has been a pleasure to serve. I saw lots of questions. Thank you so much, Lakeisha Watson Moore, for putting this on. Thank you so much for all the other panelists who are here. I saw lots of questions. I'm sure Lakeisha will have this taped and recorded. And Lakeisha, if you ever need us anytime, I'm representing Young Black professionals along with Dr. Evans. If you need us, you call us. We have lots of other material as well. And we have access to lots of other answers. So our panel went very similar to many questions. So again, good night, everyone. Thank you so much for your time. Thank you for being here. Spread the word. Whatever you've heard here, pass it on to your family and your friends. All right.
Thank you, Dr. Lee Allen. She was awesome. Yes, we're going to call you back. Yes, we're going to call you back.
Yeah, I was making sure she was able to. I'm sorry. I'm so sorry, Senator. I was just making sure that she was able to introduce our group. We did have a small group of physicians that have come together to make sure that we do get this message out there. It's called the Young Black Physicians Group. You can follow us on Instagram and Facebook. We do continue this conversation for sure. I know that was something that was mentioned. We ourselves are taking it upon ourselves to definitely continue to spread this message, answering any questions that you have. So definitely just follow us. We are constantly taking time out of our schedules to make sure we have addressed common questions and uncommon questions.
I wanted to bring up the issue around not just safety, but going to a different place than you live to go get the vaccine. And our Attorney General has put out a consumer advocacy alert regarding being wary of vaccine scams. So right now in our state, we have 2 vaccines. There's Pfizer and then there's the Moderna. And depending upon what group, whether it's a hospital group or whether it's one of our third-party groups like Walgreens or CVS, will depend upon which one you get. And so folks need to be super aware that those are the only 2 actual vaccines right now in our state, and that anything else or texts or emails or flyers or whatever other forms of communication where people are trying to suggest that some other product besides the vaccine is going to make you immune, that folks need to just ignore those and if possible report them to the Attorney General, because those are designed to scare people. They're designed to rip people off, but you combine those 2 things with a pandemic, and that just puts us even further behind the 8 ball. So we need to make sure that folks know in terms of trying to keep themselves safe, that they need to be aware of those scams and to not fall for them. So in terms of the vaccine, it's just those 2, and it'll come from a trusted source. It's going to come from your healthcare provider. It's going to come from your health department. Depending upon where you work or what field you're in, it might come through your employer. So if you're like an EMS professional or some other first responder. So those are the spaces that you'll be getting notified that it's time to take the vaccine, or you're okay to get in line to get the vaccine. Not some random email that is a spoof of another site or is pretending to be something that it's not. So folks need to be really aware of that information as well.
Yes, time will not cure the COVID, just to let y'all know. Prayer works, but it might, a vaccine aids it, okay? So just to let y'all know, I have a question. If there's one thing you want people to know about the vaccine, like one thing, what would you want them to know about it?
It's safe.
It is safe. It's 95% safe after the second dose. You're 96%. We don't have that number for any other vaccine to date.
And that's because it's not like any of the other vaccines we've had to date. I think that people keep getting caught up with the ones that used to be mutated viruses with sections pulled out, put into chicken eggs. It's not even the same technology, which is why it's so fast and which is why it's so effective. It's safe.
Yes. Now I wish my community organizer friends was on here, because I would ask them, one of the things that we're doing here is we're debunking myths. And, I think a great way that we can connect with people is people having personal relationships with other people and talking to each other. And that's how I know people are asking for a national conversation, but a lot of it starts with us getting out proper information. So where can we go to get that kind of information online if we wanted to read and then tell our cousin that thinks that sunflower seed oil cures the COVID? So where can we get that kind of information from?
So my apologies. I have 4 resources that I tell people to go to. When you want to look at, and these are national organizations in terms of national organizations and local. So if you want to say, I want to know what we look like nationally, John Hopkins COVID Resource Center is a good place, as well as the World Health Organization is a good place. Googling World Health Organization and Googling John Hopkins COVID Resource. When it comes to where we are in the state of Michigan, MDHHS, the Michigan Department of Health and Human Services, is where you go for all the information that relates to COVID when you get vaccinated. If you want to get vaccinated, where do you go to find out where can I go? Michigan Department of Health and Human Services. It will direct you to your county. It will go further and direct you to the number to call. When you want to find information about COVID, about the vaccine, besides those 3 places, the cdc.gov is another resource. It actually has great, not only Michigan Department of Health and Human Services has great diagrams, but the CDC is very user-friendly. Not only does it have a lot of resources in terms of the step-by-step process, if you think that you've been exposed and what to do, check boxes to what steps to take next. The same way with getting the vaccine. It will probably direct you to the Michigan Department of Health and Human Services.
It does.
But it is a good resource. It also shows the current guidelines in terms of what's considered the columns of contraindications and precautions to being vaccinated. It is very clear there is not a lot of contraindications to being vaccinated at this time. There are some precautions, and we kind of spoke on that when it comes to prior exposures that you've had to being vaccinated and having some form of reaction. You're just monitored instead of the 15 minutes as Dr. Lee Allen specified. You're staying 30 minutes, and you are in the vicinity of health professionals. We know the next steps to take. So yeah, those are my four. So WHSO, the Michigan Department of Health and Human Services, John Hopkins COVID resource is really good in terms of just overall tracking, as well as CDC.
I agree. CDC.org is top. And so one of the things that we didn't address, but we kind of sort of alluded to it to a certain extent, sunflower oil or sesame seed oil or whatever, none of that is going to keep you from getting COVID, whatever oil you choose to get. But there is a thought process that EVMS has an outline for a management protocol for whether or not you are trying to prevent COVID versus whether you have mild symptoms versus whether you have moderate symptoms. And I actually sent to you, Ms. Watson Moore, there's an infographic with the address on it for things that you can do in order to supplement how well your immune functions. Like there's a study that not too long ago that looked at, particularly in the African-American community, because we have a tendency to be deficient in vitamin D for sure. The last time I had mine done, I was a 7 and normal is 30 for labs, 60 in OBGYN, 80 if you see a naturopath by any means. There's a correlation between low vitamin D and COVID transmission. And they looked at African Americans in particular, which we typically have a tendency to be low. So whatever you can do in order to boost your function that's scientifically backed, that a white paper actually put out, please and thank you. You help yourself. And then when you get the opportunity to get the vaccine, you get vaccinated. Suggestions.
That's going to be posted on the Michigan United page. So all these links, I'm going to post them all there to the Michigan United page on Facebook, and Michigan United, facebook.com/Michigan United. And you'll find all the information there. This is so awesome. Okay, someone asked about the cost of the vaccine. Is there a cost to the vaccine? I don't think so. But go ahead and y'all can explain. Y'all are the doctors. I don't know. You're on mute.
$3.99 is what it costs. Yes, Dr. Evans, $3.99. And I know people are like, well, why should I get it? Because it's free. Because the goal is to be able to make it so that we get to that 70% so we can stop dying. That's why it's $3.99.
I do have a question, Lakeisha.
Sure, go ahead, Patrick.
What for all the medical staff and the center, what do you think is the estimated time frame for Michigan hitting 70%?
I would leave that to the senator. I'm not 100% sure how that would look at this juncture. I'm not quite sure. Actually, that's a great question.
Yeah, I will say that is a great question. And that's one I can't answer either, because it will, it's largely going to depend on how much vaccine we receive, when we receive, the amount of vaccine required to give every person who wants the vaccine 2 doses. Right now, the vaccine is only, I think they just started the trial in children a couple of days ago. So only 6 kids 16 and up, people 16 and up are eligible to take the vaccine. But they're all of these kids who, whose parents want them back in the school building, myself included, although I'm happy to keep them home right now and do virtual. But they can't get the vaccine yet. My kids just had their well child appointments a couple of weeks ago and got all of their other boosters, including their flu shots. But their pediatrician said, they're just not eligible because it's not available for that age group yet. So we're still going to have to get those kids in as well. It's because they are part of the population, right? It's not 70% of adults who need to be immunized so that we hit herd immunity. It's 70% of the population. So I don't know what that answer is, but I know, like, if you look at the dashboard for the various phases and when a person is eligible, if you are outside of the first few initial phases, I'm not eligible until the summer, sometime in the summer, which I'm more than happy to continue masking up, washing, social distancing, all of that, so that the folks who are more vulnerable than me are able to get it, and the folks who are working with the most vulnerable people are able to get it first. But it's going to be a while, I think, before we hit that 70%. I don't think it'll be just sort of looking at numbers, looking at how much we've received so far. Hopefully we will get more. Hopefully they will have the capacity to ramp up and make more. That it'll be a while.
Thank you, Senator. She brought up a great point about children under 16. Why aren't they able to get vaccinated with the COVID vaccine? Why aren't they able to get it? Would you know?
Studied children. So 18 was what cut off for one, 16 was another. In October or November Somebody did it before. Somebody did it October, November, either Pfizer or Moderna. I don't remember exactly who, but they didn't look at children. So they can't safely tell you what happens in children because they didn't look at anybody under the age of 16. So they're doing that data now. They're doing that research now in order to figure out what happens in children. But the point that you made, Dr. Geis, yes, children are vectors. Oh my gosh, there was that same lecture series that I'd gone to that talked about lactating women with COVID. It was an epidemiologist who was saying that they think that the vectors for COVID are kids, which is like every other disease. So literally, you get sick, you got the flu, it's because somebody brought it home from daycare, from school. So it'll be nice to see that data and see its efficacy and its safety for children as well.
Yeah, just to add, so it's the Pfizer that started with the 18 and older, and Moderna that was 16 and older in terms of the age limit or age of patients that were tested at that time. So it wasn't a matter of not wanting to test children. It's just that was the population that was a part of the study. We're currently in phase what's called 1C in terms of our distribution. So that is the 65 and older population with also patients that have pre-existing conditions as well as essential workers. Phase 2 is when we're saying the general population, in which we don't anticipate till April, May in terms of that distribution, because we're still, number one, in a limited supply of vaccines at this time. So we have only vaccinated just the number of based on what was given to us at this time. So when we're saying the 65 and older, we're still waiting, anticipating what the Biden administration will provide to the communities, to the local levels. So when we're trying to, that's what I mean by answering that question. It's a very loaded question, and it speaks to 3 to 4 months from today, just based on the phase that we're in right now. We're still in the phase 1C in terms of distribution to the 65 and older populations.
The good news is, though,
as of yesterday,
y'all had immunized, as of yesterday, y'all had 1,476,775 vaccines administered, about 734 for Pfizer, 742 for Moderna. So yay, you're getting closer.
And to that point, folks need to be patient. It is really hard, I think, when people hear there's a vaccine available, but they can't grasp it because physically they can't receive it yet, even though they might want it. So people do need to be patient, and to really pay attention to when they get that call from their physician, from their health plan, their healthcare provider, to go and get it.
Dr. Evans and Dr. Ricks-Cord, to keep it simple for me, what is considered a pre-existing condition, just so that folks know what that is?
So when you're thinking of any pre-existing condition, so I'm speaking to a diabetic patient, cardiovascular disease, be it AFib, heart failure, uncontrolled hypertension. I'm considering someone with COPD, someone with asthma, someone, I'm just trying to.
Obesity is enough to link you.
Obesity, yes. BMI is greater than 35 for sure. Anything that you are currently living with that you need support to continue to live your best life is considered a pre-existing condition.
That's a nice way of saying it, Dr. Evans. Anything that you got that could kill you right now. That's what she's saying.
If you're not using the right support to anchor you, is what's considered a pre-existing condition in its most general terms. Just it's in terms of overall, we were stating before, with all the information that we are giving you, it is imperative that you do speak with your primary care physician. It is not enough to say that what we're saying is gold and what we're saying applies to you specifically. Everyone is different. And that's why I say, when I say pre-existing conditions, as someone that has a primary care background, I still want you to see your primary care doctor, because that's the person that knows you best. If you don't have one, you can go to the Michigan Department of Health and Human Services to find a primary care doctor in your local community. For sure, this is me speaking from an infectious control epidemiology background now. So again, we are giving you information, particularly that is readily available to you in terms of looking on the CDC and the Michigan Department of Health and Human Services, and whatever your local health department provides in terms of very specific information that has been trickled down based on what is done in terms of Infectious Disease Society of America, the IDSA, and then FDA, and then the advisory committee getting together, and then we give you this information. So that's how you get the CDC information and what your local health department provides. But again, based on me going down this rabbit hole, is to get back to you saying, please see your healthcare provider with all this information as well.
All right, we're about to wrap up because we got like 4 minutes left. Okay, I'm going to ask you, where can folks reach you online? If you want to be bothered offline, though, but online, where can folks reach you, follow you, contact you if they want to know a little bit more about what you do and how they can, I guess, get more information out there? Go ahead, Dr. Victoria.
Dr. Anila OBGYN across all social media. My first name is Anila, and then you can shoot me an email as well. I'm Dr. Anila OBGYN at gmail.com.
So as I stated before, there are 2 resources that you can find Dr. Kenesha Evans. One is a part of the Young Black Physician Group. We are a group of internal medicine, family medicine, OBGYN, gastroenterology. Am I leaving someone out? Oh, and peds and neonatologists. So as a collective, we have gotten together and decided to readily stream information similar to what's going on here and making ourselves readily available for any time that you want us to be available for a platform like this in terms of timing and everything. But it's Young Black Physicians on Instagram, Facebook, as well as YouTube, where we also got together and had a panel discussion similar to this, where we really broke down a lot of the questions and myths and missing information in terms of understanding COVID and the vaccine. I'm also on Instagram as Dr. Jean I am. But yes, that's the best way to find me.
And for me, on Twitter, Sen Erica, Erika, Geiss, Geiss, and on Instagram, Erica.Geiss. And there's also senatedems.com//GEISS for my legislative website, where for constituents, they can do things like sign up for our newsletter, find out when our next coffee hours are, which are happening virtually right now. In fact, last Thursday, we did a virtual coffee hour / town hall with the head of the Wayne County Health Department, talking about vaccines and about the rollout here in Wayne County. So you can check me out in all those 3 locations.
My name is Patrick Grayson. I am Pat.Grayson on Facebook, and Manup 4 MANUP 4 on Twitter, Instagram. Typically, I always following Lakeisha, so if you follow her, you can find me. I would like to have a call to action. If you have ideas, thoughts, or comments on how we increase this messaging, please reach out to me, because what I do plan for Lakeisha and Michigan United is putting together a toolkit. Just so you can share it, you can tailor it. So the more input we get, the Senator, you're welcome to use it. But we're trying to make this information out to people in the community. So I'll be packaging that up, Keisha, Senator, panelists, for you all to share. And Lakeisha, Michigan United, thank you so much for allowing me to participate. Sorry about the audio glitches, but I'm very thankful to be a part of this important conversation.
Thank you so much. If you want to follow me, I'm pretty okay on social media. I'm on Twitter at Bougie Black Girl, GURL. And I'm on Facebook too, Bougie Black Girl, and on Instagram, Bougie Black Girl. It's all the same because I'm Bougie Black Girl. Yes, I am. That was my Nana's fault. All right. If you are interested in donating to Michigan United, our African American Leadership Council, We're going to drop a link in the chat because we're working and doing multiple town halls, getting the information out, not just about COVID and the vaccine, about criminal justice and environmental justice and all kinds of justices that need to be solved. So donate and support today. Thank you so much for joining us on Michigan United today. Regardless of how you feel, let's take care of our neighbors as we would do ourselves. Mask up, social distance, stay safe. Stay blessed, family, and look out for our next town hall soon. Thank you very much. Have a great day. Bye.
Thank you. Bye.